let's move on to the second big conversation point tonight. A scientific paper on health and economic impact of air pollution was published in the Lancet Planetary Health, and it's revealed some shocking insights and facts. And in fact, the alarming is actually the right word to use, alarming facts about the impact of air pollution. And I'm going to pull out some of those interesting facts, especially relevant to our country. Usually, viewers, our conversations about air pollution are restricted to the national capital, the pollution in the national capital, the smog in the NCR area, which state government is responsible to it. If we have to go one step further, we will end up talking about the top 5 polluted cities of this country and what is the AQI level of in that city, just how bad things have become, and what is it that the government is doing at that very moment. Let's take a deep breath and take a step back and look at this data. Do you know that as per this study, there have been 10.67 lakh deaths. 10.67 lakh deaths because of air pollution in our country. That's the information that's come out. So of all the deaths that have happened in our country, about 17% have been caused because of air pollution. Deaths due to ambient particulate matter pollution is 0.98 million. Deaths due to household air pollution, 0.61 million. And here is the other jarring cost. The data point that barely ever gets spoken about. The economic loss. Over 2.7 lakh crore, 2,70,000 crore of economic loss happens due to pollution. Lakhs of people every year in our country are dying because of problems that get created due to air pollution. How can it still not be a big concern for every single state government, every single authority, every single local body, and our successive central governments? How can it still not be the biggest talking point at any round table, at any political rally, in any living room conversation? Why don't we take this seriously? Because it's not visible to us? Because 17 lakh people dying, it doesn't show as if they are dying at that instant, choking to death because of bad air, so we don't realize? Add to this the lakhs who suffer from breathing problems year after year because they are having to live in these conditions. Imagine that. What do we do? How do we tackle this is the question I'm going to be asking. Very quickly, I just want to take you through the other highlights of this report that has actually emerged. And again, the study highlights some very crucial India-specific issues, that poor states are the most vulnerable to impacts of air pollution because you don't have the wherewithal to tackle it. That an increase in PM 2.5 level can cause climate change problems, that ground level ozone formation may take place, that the economic burden to increase if air pollution continues, and that economic burden will just worsen year after year at this pace. It can also undermine any plans we may have to increase our economy's size to 5 trillion by 2024. I mean, not that the slowdown or the recession is actually helping us, but add to that the loss because of the air pollution. It's going to impede the growth of wealth in our country. It may reduce human capital, of course, goes without saying, and the atmospheric stagnation can cause climate change. So isn't this a far worse threat than many of the other issues that repeatedly get debated in this country? Let's say good evening to the panelists who are joining us right now. Vivek Chattopadhyay, Senior Program Manager for Air Pollution Control at the Center for Science and Environment, or CSC as it's known as. Dr. Sandeep Salvi, Director for Pure Foundation, joining us this evening. Dr. Vikas Maurya, Director and Head of Department for Pulmonology, Chest and Sleep Medicine at Fortis Hospital, joining us this evening. But first up, I actually want to go across to Professor Lalit Dandona. Professor Lalit, you know, unless and until we see these figures and repeat them, it's difficult to imagine that this is how silently air pollution is destroying us.
So what's your question, Ms. Shukla?
If you could take us through some of the interesting highlights that caught your attention from this specific report.
Sure. Thank you. One of the important things that you said in your initial introductory remarks, it's not visible. A lot of the damage done by air pollution is silent. And we often think that it is primarily a lung problem. Of course, about 40% of the deaths due to or disease burden due to air pollution is lung diseases, but the other 60% is not. That includes cardiovascular disease, heart attacks, stroke, diabetes, premature births. And so it's very wide ranging. The major findings of the study, many of them captured in your introductory remarks, 17 lakh people are dying due to air pollution. Now, it's important to understand that these deaths are attributable to air pollution. It's not that it's just air pollution alone. Air pollution interplays with a lot of other risks. So what we are saying is that if air pollution were not there, then these 17 lakhs deaths could be avoided. It's important to note this because if you add up the deaths attributable to all the risks, it adds up to more than 100%. So it is not just air pollution, its interplay with the other risks is what we refer to as 17 lakh deaths attributable to air pollution. Very importantly, again, as pointed out by you earlier, it is not that it's just a Delhi problem. In fact, the outdoor air pollution and household air pollution both are quite high in many parts of the country. And if you combine the effect of the two, the household air pollution is actually much lower in big cities. And in the rural areas, the household air pollution from solid fuels, that is using coal and wood and other biomass fuels for cooking, is a big contributor. So it is a much more widespread phenomena than just in the cities. Also important to note that the household air pollution is improving in the country. That's very important to note because it's not all a bad thing that's happening. Household air pollution has improved tremendously and still more can happen, but it is improved due to various efforts by the government and other agencies. On the other hand, outdoor air pollution has not come down. So overall, the death rate due to air pollution over the last 30 years has in fact decreased somewhat, primarily because of the reduction of the household air pollution. Then is the economic impact, and that is staggering. 1.4% of productivity loss due to premature deaths and morbidity, that is disease burden, attributable to air pollution, equivalent to some 260,000 crore rupees. Plus, we estimate roughly another 80,000 crore rupees of healthcare costs related to air pollution related diseases. That is, if you compare it with the overall health spending in the country, that's about 4% of the GDP. This is over 2%, or it's close to 2%, 1.4 and 0.4% is 1.8%. So it is, if you, in a comparative sense, this is a huge impact on the economy. So in a sense, further investments in promoting efforts to reduce air pollution, many are ongoing. We have the ideas about how to control air pollution. It's a matter of implementing them more effectively. And if those further investments are made, they will more than return that investment in terms of better population health and improved economy. So, and the final point I want to make in summary is what you have on the slide right now, that the biggest impact in terms of the percent of GDP loss in the country is in fact in the poorest states of the country, which you have listed, Uttar Pradesh, Bihar, Madhya Pradesh, Rajasthan, and Chhattisgarh. And that has got to do with that these northern central states have both a high level of outdoor air pollution and as well as a high level of household air pollution because of the larger proportion of population using solid fuels.
In fact, if I may just ask you, Professor Lalit, before I go to other panelists, to just help us break this down, for a common man to understand, what does air pollution have to do with economic loss? How do you link the two? How is a smoggy air in my city going to result in loss of wealth for me and my nation?
So here's the sequence of things. The particulate matter in the air scars the lungs first, then it invades the blood vessels and causes cardiovascular diseases and diabetes and other things that I mentioned earlier. This causes both premature death and morbidity, that is, disease without causing death, a combination of that. Premature death today, let's say a 40-year-old person dying due to a stroke induced by air pollution, attributable to air pollution, will lose at least 25 years of productivity in the future. So what we've computed is that earning loss, of course, discounted into the future, and then the loss of morbidity caused by morbidity from diseases, as we computed it as using a disability measure. So the measure that we have computed of economic loss is based on these productivity losses due to both the years of life lost, where no earnings will happen, and the morbidity causing reduced productivity. And that is what it has got to do with the economy, that productivity loss will lead to loss of wealth for the nation. And that, if it were avoided, would conversely add to the wealth of the nation.
Right. All right. Thank you so much for breaking that down and explaining to our viewers. If I can just bring in Dr. Vikas Maurya first. Dr. Maurya, let's also try and help our viewers understand this and visualize this better. And it may sound a little scary and alarming, the question that I'm asking you, but many of these deaths are after a long period of misery. If it's the pollution that's impacting you, you will struggle with it for years together before you might succumb to it. What are the key ways in which it can kill you and what people suffer through? And I'm asking you to highlight this and emphasize it, because unless we realize the gravity of the situation, we're not going to participate in fixing it.
Yeah, it's very important to understand that, it's not that now it has come into the study. It has been seen for many, many years. And it has been emphasized and has been shown by the WHO report as well for so many years now, that the air pollution, both whether it's an household air pollution, whether it's an outside air pollution, is associated with many diseases and is also associated with deaths all over the world. If we see, every year more than 7 million deaths occurs, and more than 2 million deaths occurs in the Southeast Asia region. And if we see about the majority of the people who dies with this, they because of the inhalation of these toxic particles, including PM 2.5 and in the zone, they tends to go inside the lungs and cause the lung diseases. They get absorbed through the blood vessels, and then they affects your heart. They can affect your brain. They can also affect the neonatal. They can affect your hormonal system, including leading to more patients having diabetes. Again, having the lung cancer as well when there is a chronic exposure of these toxic particles, and as well as even leading in India to cataract and other disorders. So this is what happens when you are continuously being exposed to the high level of air pollution for many years. You can have acute disorders like as I said, like ischemic heart disease, stroke, pneumonia, respiratory infections, and increase allergies. And then over a period of time, you are having increased risk of having chronic obstructive pulmonary disease, asthma-like disease, then the lung cancers, and other disease like diabetes, as well as neonatal risk, to the pregnant woman. So this is very important that now we are realizing that this is are causing problem all over the world. And yes, what we see that in the developing country, I mean the problem is much higher than the developed world. So we have to understand that we have to take certain measures, and this measures has to be taken, by everybody. It's not that the government, everybody have to play a role in, decreasing the impact of air pollution on the overall health of the people. And that's why it's important that that people we are bringing more of, like the media is coming now, and everybody is trying to emphasize the the bad effect or the burden of disease which are caused by the air pollution.
Okay, point well taken. In fact, if I can just now move to the other part of it, which is our response and what should we do. And Mr. Vivek Chattopadhyay, let's start with you on that. Uh, Often the conversation revolves around the governments and the government's responsibility in taking some steps. But I want to first today start off with what is it that the people can do. There are various kinds of polluting factors, and we are contributing ourselves as well.
Yeah, definitely. The behavioral change that is required to reduce air pollution as well as climate impacts is turning out to be a major area of concern because problem is if you make the policies in the state policies, if they are in wrong direction, it impacts people's behavior. For example, like if you if you don't maintain the footpaths, if you don't maintain the cycle tracks, if you don't provide the clean energy to the households through state policies, all this will affect people's behavior to choose for other options. So behavioral change is actually linked with the individual as well as the state policies. So that is the biggest message this study is giving, and the states have a major role to play. Definitely individuals can play a role, definitely, when they choose an option, but they need to have a complete information about that option, why that is harmful. So our awareness programs probably have started, but it is not spreading that fast, and the reason is like government policies are very lax, and when people don't see action happening on ground, they think that it will happen, the things will remain the same. So there is a like always hopelessness that how the things will change. So I think this study shows that if we want to grow as a developed country with $5 trillion economy in the coming future, the health of the people, which is linked with the air pollution as well as other pollution also, but the air pollution is the major risk factor in causing premature mortality as well as morbidity, health costs for the individuals, and it is adding up to for the nation also. So how we will grow in that manner with ill health, and how the people, how the individual households, for example, a person dies because of air pollution of a 40-year age, entire household suffers, and government may spend the money for the in the health centers, providing medicines and other things, but it's a irony that if you don't control the cause and you invest in health protection, it is meaningless. You have to reduce the pollution with aggressive measures, and studies are after studies. Earlier, the environment ministers used to say that the studies conducted by other countries should not be applicable to India. They are extrapolated, but now it's very commendable, and I would say that ICMR has come forward to carry out these studies, and Ministry of Health should be integrated part of the pollution control strategy in the country. That is not happening. And often we see that these health studies don't lead to policy change. Why?
No, they don't.
Because the states don't take note of it. For example, when we say UP, Bihar, Madhya Pradesh, Rajasthan has such issues. So, shouldn't we have a strong program or an excellent program to deal with the issue? They don't have the probably the investment money that is available. Delhi has a lot of money. Delhi can invest in buses, but it hasn't invested. So the states and cities which have the economic prosperity, they are not investing, and the states which don't have the wherewithal, they don't have the investment opportunities to deal with the issue. And the interesting part of this study I read that it gives an example of United States, that $1 investment leads to $30 benefit in the long term. So whatever you invest in the current scenario, it is going to accumulate in future. Because our young generation, our children, our future generation, if they are affected, their entire life will they will suffer.
So
So
you're
how
right
the
there, but Vivek Chattopadhyay, I think you're being far too kind and lenient when you say that these reports don't go anywhere. Nothing goes anywhere in this country when it comes to tackling air pollution. Not these reports, not the numerous commissions that we've set up and the findings that they have come up with, not even what the National Green Tribunal has to say, not even what the courts have to say, up to the extent of Supreme Court. I mean, the state governments are not even interested in implementing what the courts and the Supreme Court of our country has to say about tackling air pollution. So I think taking cue from a Lancet study is far, far away, isn't it?
Definitely, the Supreme Court invoked Article 21 right to life when they passed the orders for Delhi's strong action. So when you have a precedence in the Constitution itself, and it provides you the right, individual right, as well as its biggest responsibility of the state to implement the policies which are going to, and this is happening for years and years. We are seeing that the cities which had reduced the pollution, now there is a reversal in trend. Now the pollution is increasing. That is out of control in many cities. They are not looking at those issues. So I think we have to be very serious, like the way we are very serious about coronavirus, COVID pandemic. The same kind of seriousness has to happen in case of air pollution.
Okay, let me also bring in our fourth panelist. You've heard everybody, Dr. Sandeep Salvi, your comments and especially on the fact of people awareness and what we can do.
I believe this is a very, very important report that has highlighted for the first time the economic loss that occurs due to air pollution in our country. Air pollution has always been a very neglected entity anyways. It is only very recently that we have started understanding the importance of air pollution with respect to health, the suffering and the death that air pollution causes. But this is now taking the information to the next level. What is the loss of money that occurs because of the suffering associated with air pollution? And we have got state-wise information. I think that's the beauty of this report. We exactly know what is the amount of money that is lost because of air pollution in each state. Now, this could be the starting point for the state governments to initiate policy decisions. Just to give you an example, the state that perhaps loses the most amount of economy due to the current air pollution is Delhi as a state. $1 billion are lost every year in Delhi itself because of the impact of air pollution on health. Just to give you another example, for example, Maharashtra, $3.6 billion are lost every year because of the impact of air pollution on health. Now, there are some very successful examples of tackling air pollution that could be, important markers for us. For example, the Pradhan Mantri Ujjwala Yojana that made LPG freely available to over 80 million people across the country started in 2016 has been a very successful program that has been responsible for reducing the number of deaths due to household air pollution by around 65%. And that is an achievement. If such a policy can change the impact on people's lives, I think it's important for the government to now start taking these policy decisions very seriously. It is important to create awareness not only at the public health level, but I think we need to create awareness amongst the policymakers themselves, because they are the ones who have to take decisions. And if now we have a figure that tells you that this is the amount of money you're losing every year because of air pollution, something needs to be done about it. I think the cost-effective analysis that the policy decisions will make, they'll surely realize that it is more cost-effective to prevent the impact of air pollution rather than to firefight it once it occurs. So I think it's an extremely important report. It taught me a very important lesson that 2,71,000 crore rupees are lost in economy every year because of the impact of air pollution on health. It's time to wake up. I think we have neglected air pollution quite a bit, but I'm happy that this report shows the third dimension of the impact of air pollution, apart from suffering and death. Also tells you that you lose a lot of money also because of that. And I think it's important because if India really wants to become a $5 trillion economy by 2024, this is going to be a major hindrance for that. It's important to realize that. And it's important for the government to start initiating active measures to reduce the levels of air pollution. You'll have to be very innovative in those methods. You'll have to be every state will have to have a different plan to reduce the levels of air pollution. We are paying a cost for being more modernized, for being more urbanized. And it's important to use some of the money that we make out of that to improve the quality of air that we breathe. I think the other important fact that has come out of this study is that air pollution not only affects the lungs. This is what most people believed, that it's only the lungs that are primarily affected. It's every organ in the body that gets damaged because of air pollution. And the proportion of that is very beautifully given. And so if you're a cardiologist, I think it's important for the cardiologist also to be aware that air pollution is responsible for causing a large number of heart attacks, a large number of patients with high blood pressure and so on. So I think that information is very, very important.
So in fact, I'm going to pick up on that and take our viewers also through the details, and I request all of our panelists to stay with us. I need to take a 30-second break, and in this 30-second, we're going to get all of that data together. On the other side, we tell you, various diseases that happen in our country, the deaths due to those diseases, and where air pollution plays a role, and what is it that the states can do. Stay with me.
कोई है जिससे आप करें एक्सपेक्ट मोर? हमदर्द रोगन बादाम मसाज कर या दूध के साथ पीकर ये दे हेल्दी हेयर, ग्लोइंग स्किन, बेटर इम्यूनिटी।
एक 100% प्योर आमंड ऑयल से इतना कुछ एक्सपेक्ट नहीं किया था।
We're talking about air pollution and the damaging impact, the fatal impact it's having on our country. Over 17 lakh deaths reported due to air pollution as per this Lancet study that's been published right now. Not only that, it also talks about massive, over 2.6 lakh crore of economic loss to our country because of air pollution. Professor Dandona, you referred to this in your first answer, and I want to come back to this, because a lot of time the response is, oh, we don't have the money to bring in steps or to take the steps to tackle pollution. That itself is an expensive job to implement these schemes or use those equipments or use other ways which would be more expensive. How do we, compare the two? The loss, economic loss because of air pollution versus the money required to bring it down?
Well, we have to look at what contributes to air pollution. The household is relatively easier to understand, but the outdoor or the ambient air pollution, the major contributors are as follows. The energy production, the electricity that we use, primarily through coal. Now that's as it should be because that's the cheapest. But that slowly has to move towards renewable energies, and that is happening. At the same time, it will not happen very, very quickly. So we have to reduce the emissions through from the coal produced electricity. Then is in cities, particularly the transport. Not only cities, but particularly cities transport. Public transport is not quite as near as it should be in its accessibility and quality, and that is improving in some cities. So more investment is needed there. I give these contributors because that's how we will come to the solutions. Then construction activities. A lot of construction happening everywhere. The protection from the dust flying, which contributes in a big way to air pollution, is not there. Then road dust is a big contributor as well. Unpaved roads and the sweeping of roads in the morning throws the dust into the air and causes damage. Then waste burning is a big contributor as well. The kachra that we burn, particularly in the winter season. And then there are other contributors such as agricultural waste burning, which is seasonal, but it's there. The point of all this is that this is a tedious task, and we have to acknowledge that. And two, it is not going to improve, even if we put in our best effort. Things are not going to improve within 6 months or a year. It takes time. So we have to have a 2-year plan, a 5-year plan, and a 10-year plan. This is the nature of the problem. So we have to be wise to be able to plan and have the patience to implement it without getting too restless because we do not see the impact very soon. However, if you do the computations, as one of the colleagues on the panel pointed out, in other parts of the world, US example we gave in the study, the returns to that investment in controlling air pollution is many-fold. The improved productivity through better health of the population, people who are saved and are not sick, will more than pay for that investment. The wealth generated will be far in excess. And that's the computation that has been done in several parts of the world. And we have reason to believe it will be similar in India as well. So the computations show that this investment, while it will be large, we will have to show the wisdom and the patience to be able to reap its reward in the long run.
Okay, fair enough. And I think, that's the most important part, even for our governments to keep in mind. The fact that, it may look like a large investment, a large spending, a large bunch of your budget allocation right now. But if you look at it over a longer period of time, and they often tend to not have that kind of a vision, then perhaps you will understand why it is required. Dr. Sandeep, do you want to comment on this as well? Because, you were also referring to the states that have seen a significant loss, and most of those states are the poorest ones in our country.
Absolutely. I mean, one point I wanted to make was the COVID pandemic has, brought a complete new change in our behavior. We use the mask to protect ourselves from the COVID-19 infection. Little do we know that the same mask can also protect us from the air pollutants, especially the particulate matter. I think times will now need to change, where people will need to wear masks, not only to protect themselves from the COVID-19 infection, but also to protect themselves from the harmful effects of the air pollutants. So I see that as a potential solution that could continue post the COVID pandemic. The behavioral issues associated with the use of masks is already being addressed, and people, at least to a certain extent, have started getting used to wearing the masks. So I see that as one potential solution. I think every state will have to have a completely different policy, depending on the sources of air pollutants that are responsible for causing harm in that state. So, for example, if you take the states like Bihar and Uttar Pradesh, where quite a bit of household air pollution is also because of use of biomass fuel. So there you can improvise on that. Similarly, in the northern eastern states of India, where I think the impact of air pollution due to household air pollution is much bigger than in the other bigger states of India. So depending on the state, the sources of air pollution, you need to strategize your solutions. I think by creating awareness about this will go a long way in bringing about that change.
Okay, so then what is the role, again, Mr. Vivek Chattopadhyay? Now let's talk about the governments. What is the role that the state governments individually can play or should be doing right away? Let's talk about the immediately urgent steps that are required to start the, turning around this situation.
See, the immediate steps, if you say, like, definitely many steps, for instance, if you want to change the norms of the vehicle emissions, it takes time. Okay, but India did definitely a leapfrog from Bharat Stage 4 to Bharat Stage 6 with a lot of investment, with a wisdom that this is going to have cumulative benefit in the future. The same kind of approach has to be taken in the other sectors also. Power plant sector is definitely lagging behind in big manner. All the norms have been deferred, and they are not being implemented in the power plants. We are using coal. Renewable is transition is happening, but the emission standards have to be tighter. There is no option. There is no other option. You can't have a coal-based electricity without having tighter emission standards on power plants. Similarly, Ujjwala program, definitely it's a success. But how do you sustain it? Poor households might have been given a connection, but is there a sustained effort to provide the cylinders in the long term? They will otherwise they will keep using the solid fuel or the biomass available, easily available nearby. So I think the sustained effort also is required. Comprehensive action plans have to be implemented for cities, but cities cannot be islands of clean air, definitely. And states cannot be islands of clean air unless until all the states have a regional plan. For instance, the government of India has taken a decision that Delhi NCR and surrounding regions, they have set up a commission. Similar kind of efforts have to be made for pan India, because Delhi NCR and the surrounding region cannot remain clean if the efforts are do not happen in the larger areas. So I think the policy implementation approach has to from the national level to state level and the city level. The responsibilities, accountabilities have to be fixed. The state implementation plans have to be fixed, and the financial like incentives should be given for the states who are doing well, and there should be penalties on the states which are not doing well. So I think we have to use all the economic instruments as well as strong environmental laws to bring change. And what we have seen that this is possible. For instance, there were a lot of resistance when Delhi introduced the CNG, but now the CNG is a successful program in Delhi as well as in many other cities. Similarly, LPG is a success story. We have to immediately ban very polluting fuel. For example, petroleum coke has been banned, which is very high sulfur fuel, which was ignored by the government, but ultimately the Supreme Court directed that it should be banned in the Delhi NCR states. And the government of India, I think, has restricted its use in many industries. It can be only used as a feedstock. So these are few examples. Another example is how we are doing the urban planning. We are making it is car centric, vehicle centric. We don't provide public transport. Where is the public transport? Quality public transport, accessible public transport, good walking and cycling facilities. These are our strength in the past, walking and cycling. If you look at the world map today, India, Africa, and many poor countries or developing countries, you would say, have very high share of walking, cycling, and public transport. Okay, compared to Western countries. But we are not strengthening these good things.
Yeah.
So I think the efforts have to be sustained in a manner that we achieve. Like the one of the panelists has said that it has to be 2-year plan, 5-year plan, 10-year plan. So we have to set plan and we have to achieve it, and we have to monitor that whether we are making change or not.
Yes, and we have to go beyond just setting up associations or bodies and institutional bodies whose job is to monitor pollution and come up with suggestions, because the governments, unless and until we start holding our governments responsible, and asking them questions of how much have you done, it's really not going to be of any use to us. Now, outside of the data that we've put out on top of our screens, which is the over 10 lakh deaths in 2019 because of air pollution, here is some more. Some of the other reports that we've also collated together. A WHO report that was released in October 2018 says that about 1.25 lakh children in India below the age of 5 died in just 2016 because of polluted air. The impact of polluted air was so much that we lost 1.25 lakh children below the age of 5 only in 2016. Here's another statistic. Again, this is the Lancet study from 2018, where it said 77% of India's population is exposed to outdoor air pollution levels above the national ambient air quality standards safe limit. 77%. I mean, for people in our country, I don't think it comes as a shock, but we don't realize when it starts to silently kill us and take away lives of those around us. A 2017 report of CSC actually found that 30% of all premature deaths in India are caused due to air pollution. Now, I just want to pick up on a point that Dr. Sandeep made earlier, and Dr. Vikas Maurya, maybe you can add to this. Since we've already become so used to this COVID lifestyle where everybody is supposed to wear a mask every time you step out, should this, in at least some parts of our country, become a more of a normal way of life until we get a handle on air pollution levels?
See, yeah, I think the COVID pandemic has taught us a lot in terms of the people behavior. It has been seen that even now that the people behavior and the virus behavior contributes to the transmission of the disease. We can have more number of the patients. So I think similarly, I think the behavior is if we improve our behavior in terms of using the mask, because yes, the things which will be done by the government and all this will take time, to have the fruitful results. But in the meantime, as the person, as we, living in the cities, having high level of pollutions, we can try to reduce the impact by using the mask specifically designed for preventing the the air pollution, inhalation, and the disease. So yes, in terms of this changing the behavior, the COVID-19 has taught us a lot. And similarly, what is more important is that I think there should be more health awareness campaign by the government, and also a website can be created, on the health ministry site about air pollution, its impact, and giving more information about the awareness to the people, and what the measures which the government is taking, which can also be shown on that website, which will certainly help in gradually improving the people behavior and giving us more education, and also about the measures which the government is taking in reducing the impact of air pollution on the overall health of the people.
Yes, absolutely. Well, I have completely run out of time, so I'm going to thank all of the panelists for joining us. It's been a great conversation, and of course, we will have lots more. Air pollution is not going away anytime soon. It's not even going to come under control, and the more we talk, the more perhaps we will be able to build pressure on our governments, the more the people become aware of just how damaging it is. The human cost and the economic cost. It's not just about staying indoors for 1 month or 2 months in your winter season. It's not just about saying, oh, how do we save ourselves from this cough and cold that we're getting because of the pollution? But it is about understanding how lakhs of people develop various kind of diseases because of a bad air quality in our country every year. It is to understand how lakhs of them die in our country because of bad air quality. Over a quarter of the deaths that happen due to lung cancer are caused by air pollution. Imagine that. And similarly for other diseases. It is time that we stop taking this so casually. It is time that we take it beyond just a bunch of Supreme Court hearings and a bunch of national primetime debates on Delhi pollution. 10 lakh people every year. Slowly, this one factor is slowly killing us. It's only in our hands to stand up, make ourselves aware, and then insist on a change, insist on action. Thank you so much for joining us on this conversation.